Hi, everyone. Thanks for joining. I'm Barbara. I will be your host today. And with me, I have two experts. We have Neil, who is the founder and CEO of Propane, and Alec, who is our Senior Director of UX. And we will be kicking off our 5-part webinar series on designing the next decade of patient journeys. On that note, I will hand it over to Neil to give us a quick intro on his work at Propane and today's topic.
Thanks, everyone, for joining. Really appreciate it. In terms of background, I'm one of the co-founders here at Propane, Chief Digital Officer here, sometimes known as a Chief Experience Officer. But I think the important thing is that I'm really looking at how our clients can leverage digital and map to, in this case, patient experiences in the most optimal way. I guess my background and even what we do today is that it's a really good mix between strategy, customer mindsets, technology, creative, and overall corporate sort of business objectives. So really just trying to find the balance between all of those to create the optimal patient experience is really what we've been focused on for the last decade or so. I think the agency is, and it's a little over 2 decades old now. Since I think we started in 2003. So with that, I turn it over to Alec and we'll get started.
I'm Alec Ditonto. I'm our Senior Director of User Experience here at Propane and Analytics. What that means is I work with a lot of our healthcare brands, oversee all of our healthcare clients, trying to optimize patient experiences and try to drive revenue growth and other meaningful business KPIs through improved experiences, which ends up being some of the topic which we'll get into today.
Awesome. So just for level setting, keep in mind for those of you that are on the call that this is webinar 1. It's actually the first part in a series of 5. This one's obviously about how mature your patient journey is, but webinar 2 will be getting into building teams and creating winning patient journeys. That in of itself has a certain amount of challenges and strategies. Webinar 3 is going to be about building the modern patient journey tech stack. And then webinar 4 is going to be about automating the patient experience. And then webinar 5, we're really getting a lot deeper into getting executive budgets for improving patient experiences as a whole. But for this one, we're really going to talk about maturity. That being said, when we get into patient maturity, there's a lot of different maturity graphics out there. If you search patient maturity or just the concept of digital maturity as a whole, you'll easily find anywhere from 4 to 5 to 6 different columns, and they all talk about going in various levels of maturity. We decided to keep it simple. Healthcare is hard enough. It's challenging for a lot of you practitioners to bring great digital experiences. And I think if you really just look at foundational as the first stage, you're really looking at understanding the multiple touch points. Our advice here is really for those of you that don't have a current map of patient journey, of your current patient experience, don't overthink it. You can look at tools. There are definitely tools out there, but if you can just get a whiteboard and start to plot all the different touch points, that in and of itself is a good start. Those things can cover doing discovery, put yourself in the mindset, look at how they're researching you, how they're finding out about you online, what the reviews might be, what does your scheduling look like, what does receiving care look like, what does follow-up care look like. I think that'll be great. A lot of hospital systems, when you talk about patient journeys, they don't actually have a map, or if they do, these maps are generally out of date or they're not really integrated into business strategy. And that's what we're really looking to help solve here. I think for the second phase, once you've mapped everything out, and you get into the space about integrating, you're really looking at putting all of these touch points together. And again, to best do that, you can map your experiences, yes, but then create a second layer that's really about the architecture, the technical architecture. What applications are you using to connect what together? And in addition to that, we would also suggest that you put together teams. So I'm not necessarily saying build an org chart, but do put some people in your organization that might be responsible for certain experiences, because what you'll find out in patient journey maturity is that it's largely a team-based sport. There are different individuals in different departments responsible for different things, and patient journey is one of the practices that really does a great job of bringing all those things together, along with its said challenges. What you'll also find is that a lot of organizations sometimes just don't have an overlying structure in place. We'll touch on that a little bit later when we talk about that second webinar in terms of building teams that win. And then for phase 3, you've got your foundation, you've got your integration maps, you've got your tech stack, and now it's really about orchestrating experiences. And what do we mean by that? A lot of people say transformation, but orchestration can be something as simple as if a communication went out to a said individual, they have what's called a digital footprint. You know about them, certain things about them, or they're like a looky-likey persona. Those things need to be orchestrated. So, for example, if somebody happens to be interested in oncology, you can send them oncology care. If they happen to have a child at your hospital in about 9 months after their pregnancy, they're going to be interested in other stages of that child's development. So look at that digital footprint and try and map to them. And that's what we really mean about orchestration. Alec, do you want to add anything to this?
No, I think that covers it. It's just really those three key phases are good foundational touch points to check ourselves against to see where we are today versus where we want to get to identify gaps and opportunities.
That's right. That's right. And you can thank Alec, everyone, for simplifying this too. He was the one that really made it a big point of not going from 6 columns to really getting to 3. And I think that's right. So that being said, if we go into why patient journeys maturity actually matters, it's because there are high expectations of patients today. I think what's interesting about hospital systems as a whole is that they are getting better, they are maturing, the experiences are getting better, but are they at the level of what your consumers are at? People are used to things like Airbnb, they're used to things like Uber, they're used to things like WhatsApp, very easy, utilitarian, thought out experiences. And it's not hard to see why they expect healthcare to work the same way. I think, Alec, you probably had a couple other examples that you wanted to share too in terms of expectations.
I think just getting to the consumer focus, these are the apps that we all use every day. We're door dashing our meal, we're paying for our prescription at CVS before we pick it up, and then we're saying we're here and they're running it out to us at the curb. We're buying things from Target the same way. So it's just how can technology be integrated into every touch point of your brand? And you can't do all of it overnight for certain. Starbucks started their wallet app a long time ago, and then they decided, okay, we can gamify it, and that brings people back. And over time, they've built really loyal customers where they can actually track, where they're actually looking at things like engagement metrics, like daily active users. And it's that level of sort of long-term thinking and planning that is, if you orchestrate that around the patient journey and the touch points that you have for your particular system, you can really find the high impact, low effort items to tackle first, build your roadmap, and then over time deliver these consumer grade experiences in healthcare, which is, I think, as healthcare consumers, as everyone is a healthcare consumer, we can all say that there's a lag to some degree in healthcare compared to other industries, and it's the responsibility of us to map what those opportunities are and then take advantage of making them meeting expectations that consumers have.
You make an interesting point, which is that in gaming and a lot of these applications, everyone's done such a great job of making things sticky, creating reasons to come back. I wonder, what is it that's really preventing healthcare from using gamification or using habit-driven sort of structures to get people to come back? What would you say, Alec, is the challenge in that? We see it clearly that they're not using it, but what do you think? What do you think the reason is why?
We could have a whole webinar about this, but it spans from everything from regulation and HIPAA and just how we treat data. Of course, we don't want to violate any of that, and we have to be very respectful of how data is used. But at the same time, if I'm a Weight Watchers user and I'm checking in every day to my app to record my food and my weight and get tips on recipes that I can cook, those are like daily engagements with an app that benefit my health. So we're in the sphere of healthcare. And I mean, it could even lower insurance costs for me if they can see that I'm losing weight. Getting that type of integrated experience into our healthcare networks is something where it's light gamification, it's engagement driving, and it has great patient outcomes. So there are totally ways that this could happen. It's just a matter in general of, I think, funding, vision. It's hard for healthcare systems to provide healthcare and then also be competitive in other verticals. So thinking about how to hedge your digital strategy away from just selling your own healthcare, but to also providing those complementary experiences is a huge, rich vein that can be mined to help improve your patient journey and also create loyal customers.
Absolutely. And then when we go to the second point, just looking at time, but just about steep competition, you've got hospitals that are in local region. people have choice. For every hospital client I talk to, they at least have 1 to 2 competitors that are within a particular region of their said hospital. If they happen to have 9 hospitals in their system or they happen to have 20, each of them happens to face local competition. I think another thing too is why patient journey and maturity matters more is a lot of people talk about AI. Patient experience really starts to lay out workflows or paths. And I've always been a big proponent of don't just use AI to solve things or think that it'll solve stuff. Use AI to improve existing workflows. In this case, improve existing patient experiences. So I think setting that foundation, setting that strategy first, making sure you know what it is, and then looking at how AI can drop into those small areas so that you get the aggregate benefit, I think is really key. I think we're always constantly struggling. We're talking to clients thinking that AI can solve everything, but really at the end of the day, you've got to understand your process. You've got to map that stuff out. And I think journey maturity really helps set the foundation for that. There's been about 6.5 million patient encounters surveyed, right? And in these surveys, they've gone into HCA, HPS, and ERAM frameworks in terms of these surveys. But in these surveys, while they collect the scores of the hospitals and they report them and hospitals can use them, they're largely, from my standpoint, not that helpful to consumers. I've gone to some of these reports and as a consumer hat on and said, okay, what does this report tell me? And some will say it's 4 stars, some will say it's 3 stars, but then they'll say bedside manner is less, so they'll say technology is good. These kind of surveys are really interesting. I feel like they don't necessarily benefit the end patient as much as they try and at least give hospitals a system or a rubric to react against, which is good. From these surveys, 50% is down in millennial scores. Their overall satisfaction is down as a whole. As we look at the sort of younger generations coming on, patient experience is even more important. That digital maturity is directly correlated to hospital care outcomes. There's a direct connect. So for those that register high in digital maturity, they also register high in patient outcomes as a whole. And so if that's not a good enough reason, besides all the other great reasons, that's one that, people should really stand behind. For those of you that are out there on this call, as we're talking about maturity, there's some quick things that you can look at. You can look at low maturity signs for fragmented systems, to manual appointment scheduling, to poor communication. These are all the things that are in low maturity signs. If you're checking any of these things off, you have immediate things that you can do today and should do today. If you're at the high end where you've got a unified patient portal, that's great. If you've got seamless data flow between all the touch points, that's amazing. I think a lot of hospitals have 98% EHR integration, and that's done well in the US. We're a lot higher than the rest of the globe. Europe and everyone else is it's 8 stages. They're basically stage 6 or stage 5. So we're doing well in the US in terms of integrating EHRs, but are we doing well in overall patient experience as it relates to the expectations of our American citizens? So again, personalized patient experiences at scale becomes something that's hard. And last but not least, predictive analytics. This is where AI can come in as well, really to help drive care decisions is going to be huge, or is huge. We've worked with health systems like Banner Health and Kaiser, and it's been great working with those guys. They're on the larger side, sure, but even looking at the challenges they face at an enterprise level versus what a medium-sized hospital system faces versus what a smaller hospital system faces, they're all relatively the same. They're just at different scales. So one of the other questions that came up is that, hey, we noticed that you guys do a lot of work in patient experience. How does this sort of connect to revenue? We're having a hard time justifying revenue. The number one insight, if you take one thing away from this early intro webinar, would be this: tie your patient experiences to the top 5 revenue centers. All of you guys that work in hospital systems know cardiology, orthopedics, oncology, neurology, gastroenterology all make a decent amount. They're profit centers. So if your patient journey isn't dipping in and influencing each of these things, you're missing the ability for it to actually create revenue, which is something that your C-level is going to be looking at as they look to invest in patient journeys. There is a 6th category generally called women, infants, peds. I think women deserves its own category on its own, but sometimes in hospital systems, they get lumped into women's health, infants, and children. It's a good way to build loyalty. If you have a great patient journey experience for pregnancy, you've built automatic loyalty to the system. And so that's why that comes up. But what does that look like? When we've done our work with the previous other health systems, we actually went and ran workshops with the head of service lines for each of these areas. Cardiology has a lot of opportunities for remote monitoring, things that you can tie into the patient journey. There's a lot of different things that you can do before care, during care, after care, and really build that sort of holistic experience for cardiology as a whole. For orthopedics, if we just took something as simple as hip replacement. I've got my mother right now. We absolutely know she's got busted knees from a car accident that she's in. She needs, knee replacements, and she won't do it. She really thinks the surgeons are there to just sell her on an operation that she doesn't need. That's a lot of decent content and opportunity to help circumvent that, or even give that to the adult children that can then bring that to their parents. And so there's opportunities there in the patient experience as well. For oncology, like I was saying earlier, for Banner Health, they had a partnership with MD Anderson that had great protocols, great cancer physicians, and they brought all those things over. Why? Because they were trying to help the patients not have to fly to Houston and to do it in their local Arizona area. We ourselves, actually, along with Alec, have also built this whole cancer patient navigation system on a subsequent webinar. We'll get into the details of what that whole application or what that whole single source of care looks like, or how your hospital systems can really go beyond just being the provider of oncology to really understanding the ecosystem that happens in neurosurgery. I myself was maybe sharing a little bit too much, but I had a spinal cord injury. So I was actually paralyzed from the waist down. I had a climbing accident. But right now, when I'm looking at neurosurgery, I'm curious about what are all the latest technologies or clinical trials or hardware that's out there. There isn't really any hospital that's collecting that stuff or making that stuff surface to me. And so there's, like I said, there's a lot of different opportunities in each of these categories for improvement in the patient experience as a whole. That being said, one of the other things that
Sorry, Neil, the one thing I just wanted to say on that slide is you'll learn is it's not a one size fits all. So we learned early on that every service line can handle and treat the patient journey differently. So when it comes to optimizing it, taking advantage of opportunities, you can customize and orient your approach to those service lines if you can be really diligent in how you work. And that goes back to your team size, your team structure, and all of that kind of stuff that we'll get into in later webinars. But there was a question in the chat that sort of brought on like the concept of how do you avoid slowing down providers or adding tech burden? And we'll get into that later. But what I just wanted to say is that optimizing your patient journey really means diving into this level, taking it service line by service line, taking it persona by persona, age by age, so that you can actually optimize it in the right way with the intention of not affecting clinical experience as well, or provider experience. So those are metrics and things we'll put in place, guidelines, boundaries we'll put in place to avoid negative outcomes despite positive outcomes somewhere else. So it's a balancing act, but it's something that getting into the details is required, and approaching service lines as their own unique experience is important to do.
Yeah, actually, Alec reminded me of something that we ran into quite a few times when we were meeting with the heads of service lines or each of these business units. We call them service line heads. They weren't even thinking about the patient journey. What's on their mind is wholly different. They're looking at what are the best doctors we can hire? What are the facilities? What are the machines that we need to purchase? There's so much in this world of operations, which makes sense because they're in charge of that particular practice. And I think it's a really good opportunity to talk to them, understand what their challenges are, and see how the patient journey can actually help support what their actual business needs are, because they're wildly different. They look at things at a much different lens, I think, than you would think. So the other thing I think that is worth bringing up, very important, is that patient journeys as a whole, there's a big conversation about we need to do advertising. We need to make sure that we fill up our beds. It's a negative way of looking at hospitals, but if you've got X amount of beds to keep them all full, what's the vacancy rate? But with all the marketing that's out there, the data still shows that word of mouth still has the highest impact to the economics of a hospital. The challenge is when you look at word of mouth, you can look at things that you can do in the community, sure, but then the conversation sometimes stops there. We are proposing and have seen that patient experience maturity work actually impacts word of mouth more so than people think. If you think about word of mouth as a whole, it's the one thing that helps you navigate and stay competitive in a local situation where you've got 3 or 4 hospitals in a metro area. Word of mouth will be the thing that separates you. Positive word of mouth examples are things like good care, short wait times, friendly staff, sure, but those things attract new patients. Negative word of mouth are things like billing issues, long waits, poor service, poor follow-up, pushing patients towards competitors because they weren't able to follow up the right sort of information. At the end of the day, people have a trust factor. It comes from recommendations of family, from friends, from local doctors, more so than it comes from advertisement. I'm not saying advertisement isn't needed. It 100% is for awareness and brand recognition, but the power of word of mouth that can be influenced by patient journey work is huge. And like I said, you can also tie that right back into your community engagement as well in terms of sponsoring events, sure, but also with outreach and local partnership help. Those can be built in to the patient experience as a whole. The main thing is to focus on patient experience, monitor the reputation, highlight the specialty, sure, but also encourage patient stories that result. And we don't think about patient experience in terms of collecting feedback or story back built into that patient experience as well. It's very much, was I able to book the doctor? Was I able to schedule the time that I need? Did I see the specialist that I need? But what is that feedback loop? And is that built into your patient experience? These are all things that drive revenue. And just for sake of timing, patient acquisition, retention, very important. You will find operational efficiency, and ultimately this will lead to better financial performance as a whole. We do have a very simple, easy to use patient journey scorecard for those of you that haven't started this patient. We realize in our audiences, we're talking from starting to mid to high maturity. And so for those of you that are more on the beginning side, here's a scorecard that we're going to allow you to download. We're actually going to rev it over this series. So over the next few webinars, we're continually going to add to it and make it better. And so get started with this, profile your competition, see how they score, and just know that, hey, from a score from X to X, I score an A, or I have a B, or I have a C. At least give yourself a number that you can respond to and move upward from. I think that's the key thing, is when you want to improve things, having a concrete number in the sand is really important. I think from there, I think it's really important to address, and we'll get into this more in our other webinars, that when we're building momentum without breaking the budget, we actually have to look at like why journey work remains underfunded as a whole. Generally, it's hard to find ROI and present it to the C-level leadership. And in a subsequent webinar, we'll get into the details of how to do that. You'll also notice a lot of hospital systems just don't have the structure. They might have a marketing group, they might have an IT group, they might have somebody in operations, but there just isn't somebody inexperienced. The larger ones tend to have teams that are focused on it, but the smaller ones, what are they to do? And so is it marketing's responsibility? Is IT's responsibility? And there are ways to circumvent that, and we'll talk about that in future ones. Like Alec had mentioned earlier, privacy regulations are really important. You've got on one side of the coin all of your prospect marketing, and then on the other side, you've got protected EHR data, and they can't talk to each other, and they shouldn't talk to each other. But there are ways that we can use technology to build profiles and build things that have similar lookalikes of your actual audience based off anonymized current patient data that you can then use to influence your marketing data. And we'll get into that in a subsequent webinar. So we'll leave you with this too, in terms of finances, because budgets are really difficult. Really want to start small. We've what would you say, Alec, over the last decade or so, we've realized that we've come up with the reality, which is that you really want to have right-sized digital wins. Start small, focus on small movements that you make, take that to your leadership, and we'll expand on this more later. But imagine focusing on a small area of your journey, going to leadership and saying, hey, we need a little bit of budget. We're going to look for these. And if you come back and you show the gains on that, that then helps leadership then continue funding for the next thing. So instead of looking at patient journey as a giant investment that most C-level hospitals are going to deprioritize given all the other stuff that they have on their plate, approach them with micro wins or micro initiatives and cycle the success of that to then get the next one and make your way through the roadmap. So again, we'll get into that more as time goes on. Wanted to thank all of you guys for jumping on this webinar. I know we went quick, but wanted to keep it short and sweet and let you know that this is the first part, like I said, in the series. And from there, we can open it up to any questions or comments. If I don't know, Barbara, if we have time or if we're out. So I'll leave it to you.
Yeah. If you guys have time to address just one question, let's maybe get some of the first ones that we got. Sorry about my mic issues. It was my fancy mic that did it. And speaking of tech burdens, Sarah is asking, is there a way to make sure patient outcomes improve without unintentionally slowing down providers or adding tech burden? Now, I know this is a big topic and could probably be an event of its own, but is there anything that you can give insight into, or at least mention if we're going to be talking about this in the webinar series?
Yeah, I'm curious what Alec would say to that. If you want to improve patient outcomes without unintentionally slowing down providers, you're not necessarily, the whole point about patient experience is that you're making their experience fast. Now, slowing down providers can mean a lot of things. Is it slowed down because implementation was complex? So I think it's a good question, but I would look at it as what is the actual investment and a level of effort and a total cost of ownership needed in order to get this patient experience, and is it worth it? And that's why we say start small. There's a whole other thing I want to get to in another webinar that talks about how hospital systems should be architecting their digital experiences in a platform way. That's one of the things, obviously, we specialize in terms of being a platform player where you don't need big things like Adobe Experience Manager or Salesforce or any of these other massive behemoth platforms. And I know I'm going to get a lot of heat for that because it's going to sound like it's crazy, but the way the technology has been moving in the last 5 to 10 years, that's where you can start to see how to reduce tech burden, not slow entities down, and actually improve patient outcome as a whole. So we can get into that. Is there a way to do it? Yes.
Yeah. And I would just add a tactical lens to this is when you're identifying your patient journey, you're assessing how mature you are in your current journey in terms of optimizing it and meeting patients where they're at. You're going to develop a roadmap, so to speak, as your first output of your assessment. And in that roadmap, you're going to have a list of opportunities. You're going to want to prioritize that based on impact versus effort. And impact is what I want to narrow in on here, because we can define impact as impact to patient experience or patient perception, but we can also measure impact as a complex metric that includes provider experience and clinical experience as well. And so by having contraindicative metrics in place so that you can, and I talked on this a little bit earlier, so that you can have the right kind of barriers in place, as long as you're baselining as you start, you're saying what you're trying to move and how you're trying to move it. And then you're saying even how much we think we're going to move it by, and how much are we comfortable with this metric over here going up or down along with this. That strategy up front of how you plan to make a change is part of the work to be done, so that when you actually go into doing the work, you can hold yourself accountable to something. And so that's how we approach measured work where we can actually show ROI, is by ensuring we have analytics and measurement and metrics in place with any of the work that we're doing. And that sounds like a lot, but that's why we start small too, because when you do something small, like the right size digital win, it becomes easier to show what you're expecting to impact, and then to understand, okay, what might that impact on the clinician side or the provider side. And that level of tying the two together and including that in any sort of reporting or planning you're doing is, how you can do this. Now, specific examples, every situation is different, and your metrics get to be something that we're going to talk about in later webinars. But yeah, exactly. But my point is just that if you have a plan, you understand the relationship, and you give yourself some guidelines or some boundaries by which you'll allow certain areas to move, that becomes your cornerstone for what you're doing. And then in terms of, so it's like, you don't want to do anything in a vacuum. You don't want to optimize the patient experience, but burn out all your clinicians, right? And so that's the design work, that's the strategy work, that's the work of making and optimizing the patient experience in the right way. Because if you lose all your great doctors to a high tech burden, your patient experience outcomes are going to fall too. And so it works as a system.
It's not going to work. Yeah, exactly. That's great. And we'll unpack all of this in the next series. So we just want to keep it short and sweet, get you guys introduced to the series, and let you know that we'll be unpacking these things in more detail. So thank you for all of you that have joined. And we look forward to seeing you on the next webinar. Back over to you, Barbara.
Absolutely. Our next webinar will be about building teams to create winning patient journeys. So we'll talk about how to coordinate across marketing, clinical, IT teams, run human-centered design workshops, align with your team, and decide what's actually feasible. And we'll dive into some of those topics. You'll hear from us via email and you won't miss it. And in the meantime, we will be sending you a recording of this and the patient journey scorecard that you can use. So thanks everyone for joining us, and we will see you next time.